preservation surgery is an approach where we try to preserve the human knee. Now, not everybody is eligible for joint preservation surgery. If, for example, you have arthritis in all three compartments of your joint, and the joint is very degenerate, it's very painful, doesn't move very well, then joint preservation surgery is not a possibility, I'm afraid to say. So when considering eligibility for joint preservation surgery, the patient's alignment is always assessed first. Now, some people are slightly bow-legged, some people are knock-kneed, and some people have dead straight alignment. And I'll try and show you what I mean on this model. So this particular model has a neutral alignment. Now, somebody with slightly bowed legs has this form of alignment where there's more pressure going through the inside of the knee joint. And some people have valgus alignment with knock knees, and this puts more pressure on the lateral side of the joint. And with these variations in alignment, varus to valgus, different parts of the joint are being more engaged on a daily basis. And so the wear pattern in the osteoarthritis takes place in one part of the knee. So for example, in a varus alignment where the medial compartment is stressed when walking and loading on a daily basis, the medial compartment wears out first. And quite often, there's very little wear in the patellofemoral compartment and no wear in the lateral compartment. And this can affect anybody any age. And so treatment modalities and surgery has been invented and developed to be able to try and treat the underlying alignment issue, which is what the problem is with a varus or valgus alignment. The way this is carried out is we, first of all, take a full history, examine you and assess your alignment externally, physically, and also by doing x-rays called long leg alignment views. The long leg alignment views show the mechanical alignment and the biomechanical alignment of a particular patient. Individuals with a varus alignment have their body weight and the mechanical axis passing through the medial compartment. Patients with a valgus malalignment have their body weight and the mechanical axis passing through the lateral compartment. These x-rays are analyzed and the various angles are measured. And based on these measurements, a plan is then instituted for what type of surgery may be required. Now, the major plus point of a joint preservation operation, and when I say joint preservation, I mean an osteotomy operation. An osteotomy is, by definition, is an incision in the bone, osteotomy. And by making these incisions, we can either remove small wedges of bone or open small wedges. And what that does is it corrects the alignment of that particular patient. So if you've got a varus alignment, and after all the angles are measured and we feel that the deformity causing the varus alignment is in the tibia, then a high tibial osteotomy operation is offered. Less commonly, people present with knock knees or valgus malalignment with arthritis in the lateral compartment, which is the outside of the knee joint. The operation that is carried out is called a distal femoral osteotomy. So this is the distal femur, and what we're aiming to do is to go from a valgus alignment to a neutral alignment, and this is done by taking a very tiny wedge of bone out of the medial side of the knee and applying a plate to hold it. So the principles are similar, but it's a slightly different operation.